Hi everyone, this is Kerry Smith. It's glad. Thank you so much for allowing us to spend some time with you today. I apologize for the delay. We've got looks like about 76 people online now, and we had a bit more participation than we thought, so we had to expand some slots on the meeting deal here. So apologize for that. Thanks so much. This presentation is going to be about the 2014 Affordable Care Act and the individual mandates for the dental practice. Again, hi, I'm Kerry Smith. I'm principal partner at Dentist Secure. I want to say up front that if we discuss any particular policy information, I just want you to read your existing policies for any exclusions or endorsements, and just basically to let you know that we're going to be discussing things in general terms. And it's always a good idea to read your policy to understand exactly what it insures you for. So that's that. And then, so the latest that we know right now is as of August 1st, 2013, is that there's already been a delay to 2015 for the requirements that an employer with more than 50 employees should follow. So the Affordable Care Act mandates for those people are going to be shifted to 2015. Things are still kind of fluid with respect to how this will impact individuals and small employers under 50 employees. So I just want you to know that we're still kind of in a fluid situation here. So this is really, please consider this just a point in time uh, uh, presentation to get you some information on what's going on and what does the Affordable Care Act mean. About us, hey, we work with a lot of doctors and dentists. We have more than 50 insurance companies we currently work with. We do every line of insurance out there for dental offices, their families, and their staff. We even do startup consulting to help new dentists with the process of understanding risk management and what insurance programs they'll need for new practices. And we also have a risk management consulting practice that looks at the overall spectrum of risk for dental practices and offer up ideas on how to manage those risks. We do healthcare. We do a lot of healthcare, and these are some of the carriers we work with. And right now, we've got about 250 medical offices that look to us for insurance, including healthcare insurance. So we've done this quite a bit, and we've got a lot of information to share. So let's get down to it. So some questions that we're going to answer today. Here's the most of the list of the questions I get currently. My staff answers these as well. The main ones being, do I have to buy coverage? What's going to be covered? And what if I can't afford it? Those are the main questions we get. And then there's some other ones around those that we'll answer through the presentation. So let's just jump into this. And I know your time's precious, so I'm going to go kind of fast through this. And if you want a personal conversation with us, just give us a call, and we'll help you understand the details here. But this really is intended to give you a high level overview and hit the high points. So if you need more detailed information, please call us. Okay. And oh, by the way, we're already getting some questions submitted off to the side through the chat. So if you can, just please, if you want to surface questions, please do. Once this presentation's over, we'll discontinue the recording and answer questions from there. And then also my staff will answer questions as they individually as you promote them directly. So we can get you taken care of. So all right, so the way this all breaks out, there's going to be three segmentations. There's going to be individuals and family. There's going to be small group and large group employers, and the programs that will be presented to you um, will will be separated in these manners. This presentation will focus only on individual or family, and we'll record out another a webinar later on small group, large employers. Matter of fact, that's happening in the next hour. So if you're interested in that, dial in. Some of it will be redundant, but you'll get specific information relative to small group and large group and the tax credits and all the eligibility requirements there. The major provisions of the Affordable Care Act of 2014 are as follows. We're going to now extend health coverage up to children to the age of 26. And we're going to do some cool stuff like guaranteed issue, which means that when you apply, the carrier will will guaranteed issue the policy regardless of your health status. They're also going to mandate that the carriers will prohibit charging consumers higher premiums based on health or gender. They will continue to base premium on age, so that still will be a factor. And they will eliminate the annual or lifetime coverage limits. We'll also prohibit the coverage limitations based on pre-existing conditions. That's a huge point. And then they'll also give you prohibit, exclusions for coverage based on your participation in any kind of clinical trial. And then lastly, they'll introduce an 80/20 MLR rule, which is the medical loss ratio rule, which basically is a measure that says if the insurance company makes more money than more than 80% of, excuse me, they have to spend 80% of their premium dollars they collect on delivering better health care. If they go over that, then any excess will be rebated back to the members. And so that's a check that allows that ensures that the customers are getting the best rates possible. Um, the plans today, 2013 and previously, if you went to an individual insurance company and asked for individual healthcare coverage, you may get upwards of 17 to 25 different options of deductibles, co-pays, co-insurance, and what these plan levels do are they're designed to make things more simplified, and it helps the consumer determine coverage A, carrier A or carrier B, and how much the cost is. So basically, what we're doing here is we're going to break it out into, instead of having 17 options, we're going to have 5, and we have catastrophic coverage, bronze, silver, gold, and platinum. The qualified healthcare plans, which are submitted by the insurance companies, are required to offer silver and gold plans in the marketplaces. But by option, they may offer catastrophic, bronze, and platinum plans through the marketplace, or you can get it direct from those carriers through us, through a broker. So at a minimum, the carriers are required to offer just gold and silver plans. The essential benefits. So the Affordable Care Act in 2014 of 24 not of 2014, but the mandates are going to basically say the carriers should have to offer these 10 essential benefits, and some of these are huge because they were not included in individual plans previously, and a lot of my clients are frustrated because of the exclusions, but now we're getting some of those back. So here's what they are: ambulatory patient services, emergency services, hospitalization, maternity and newborn care. That's big right there. Mental health and substance abuse, prescription drugs, rehabilitation, and habilitative services and devices, lab services, preventative wellness, chronic disease management. And then the big one here, I'm going to have to get a pen out for this one. Let's see. Pointer. I'm going to have to circle this one. Pediatric services, including oral and vision care. So if you're a dentist or an optometrist that happens to be watching this, this is huge because every person that buys an individual or family plan and they have children will get dental care for their child included. The plans do not include coverage for adult dental. You have to buy that on a separate plan. Tax credits. So this goes to the question of what if I cannot afford the healthcare plan. So basically the way this tax credit system works like this: if you enroll through the marketplace, which means you go through the government's marketplace website, you may be eligible for premium tax credits, which can reduce the cost of the premiums. And if you do get tax credits, you can have a choice to apply the tax credit up front to the healthcare company, and at that time the government will send the premium payment, the credit, to the insurance company to reduce your premium charges, or you can elect to have the tax credit applied to your tax return at the end of the year. And then the last little item here, which is kind of the thing to know here, is that the IRS will monitor the compliance with the purchasing mandate. So if you're not buying insurance through buying individual healthcare insurance, and you'll have to show that on your insurance return or your filing, the IRS will be the government entity that will determine whether or not you're participating. So eligibility. So who's eligible for tax credits? So we've got some items here. So you're eligible for tax credits if you meet the following criteria. You're not eligible for minimum essential coverage through an employee-sponsored plan, Medicaid, CHIP, or Medicare, or any other forms of coverage like VA, those kinds of things. If you have an annual household income to qualify, it has to be between 100 and 400% of the federal poverty level. And then they throw in here at the end that if you're a lawfully present non-citizen who is eligible for Medicaid by reason of immigration status, you will qualify for tax credits if you are 100% below or 100% of the federal below the federal poverty limit. And then there's other couple things here, but you must meet the following criteria for tax credit. The last one is if you're eligible for coverage through a qualifying health plan. So that's the tax credits. And I kind of went through this a little bit fast because this is a eligibility thing that will come up on a website. If you have specific tax questions, please talk to a CPA. We're not a CPA firm. We don't offer tax advice. But if you have tax questions, please talk to your CPA. The next question you have is, okay, I think I might qualify. So what is the federal poverty data that I have to be within? And this is the federal poverty data we pulled up. So what this says is if you are two people and you make less than, or the poverty guideline is 15,510. So to qualify for a tax credit, you'd have to be between 100 and 400% of that $15,000 number. That's how we interpret it. So how are you going to buy this stuff? So individual or family health care can be purchased in two ways. The one way being call us and we can help you through the purchasing process, or you access the marketplace. Either way, you get the same price and the same product. But the marketplace is what was formerly called a healthcare exchange. This is the website that will do certain things for us, and it's going to basically ensure that the insurance companies are submitting qualified health plans and they meet all these requirements. And then also it's going to help you determine if you're eligible for enrollment in a qualified health plan. It's also going to tell you if you're eligible for premium tax credits. And it's going to, if you qualify for Medicaid and or CHIP based on your income data, it will then help you facilitate that process of purchasing those programs. And then lastly, the system will facilitate the enrollment process for the qualified health plan. This is the individual mandate. It says basically individuals that are not eligible for an exemption are required to demonstrate that they maintain minimum essential coverage or make a payment when filing their federal tax and income tax return. This or make a payment means you will be fined for not demonstrating that you have minimum essential coverage. That's how we read it. And the coverage can be purchased through the federally facilitated marketplace. Now, we are a federally facilitated certified brokerage. We can help you with this process. And I want you to know that we went through a lot of classes and a whole bunch of government paperwork to be able to do that. So we are a federally facilitated marketplace advisor. We can help you with that. So if you back to this make a payment thing. Individual penalties for not participating in the plan look like this. Yeah. So okay. So hold the questions to the to the end. This is always where we get bogged down with a lot of questions here. In 2014, the plan kicks off on January 1st. You have to enroll by October. The October 1st enrollment starts, and you have to get enrolled prior to the January 1st. If you don't enroll in a plan, the individual penalties look like this. $95 per adult, $47.50 per child, up to $285 for a family, and then the big or 1% of your family income, whichever is greater. 2015, you can see that the premiums or the penalties look like they almost triple. And then on 2016, they were looking at $695 per adult, $347.50 per child, and $2,085 for a family, and then or up to 2.5% of a family income, whichever is greater. So what they're saying here is that look, you're going to be paying money for the plan, whether or not you have a plan or not. So um, that's what the penalties look like. Enrollment periods. You're going to be seeing a lot of information come out on or about October 1st, which will be the start of the enrollment period. Um, if you and then that will be for the January 1st, 2014 start. From there on, if you need to enroll and if you submit your paperwork or apply before the 15th of the month, you will be eligible to start coverage the first of the next month of the following month. If you enroll after the 15th, your start date will be the first of the month after next. So that's basically if you enroll January 16th, your start date will be March 1st. So that's what we've been told as far as the enrollment dates. And then there's also special enrollment periods that are tied to life events such as marriage, birth, termination of a job, or losing coverage. That is where these special enrollment periods come in, and you have 60 days to um, enroll in an individual plan if you lose coverage from one of these other covered programs. So how we work with you. Like I said previously, we are a federally certified health broker. Now, this is a little bit of an editorial here, but I have to tell you that judging from the work we do with our clients, this isn't as simple as, hey, go to a website, enroll, and have a good life. There are a lot of questions relative to what type of plan should I select? I have a budget. What if my employer doesn't offer me coverage? What are the tax credits I could potentially receive? So what we've done is we're now certified. So we have a user ID and a code that then goes to allow us to help advise you and help you along this path. Yes, full disclosure, we do get paid by the health insurance companies for that, but this is a service we provide for our clients, and I want you to know that you'll not just kick you to an 800 number and say, hey, get good luck. What we'll do for you and your family and your staff is, we'll explain the options that are available. We'll help you determine if you qualify for tax assistance, and we'll help you select and enroll in the health plan. Through that, you would designate us as your agent, and we support you and service you as we go through time. And there's a note here: there is no product or price difference if you work with us or if you go direct to the government's call center. Um, but with us, what you get is full service, and we'll work with anyone that needs help. So a little bit of a difference there. That may not be apparent if you're looking at websites that say, "Hey, go to the government, and you'll be taken care of." So it's just a difference there. What will be the potential impacts or potential issues for dentistry? Well, the first one is that, guess what? Everybody's going to get better health access. Let me rephrase. Everybody's going to get better access to healthcare, including your staff. And there's going to be some things that really bug a lot of my clients, which is the pre-existing conditions and the maternity coverage exclusions. With those gone, I think that's going to be helpful. Now, then the flip side of the coin is it really depends on what the individual premiums are going to be compared to the employee cost for small group plans. So if you don't offer an individual, or excuse me, if you don't offer a small group plan as an employer, we're going to have to look at how much these individual plans are going to cost, because we don't have any indication from the carriers now on what these things are going to cost. And if an employee is not tax credit eligible, you may see employees selecting employers that offer health benefits versus employers that don't. So just, I don't have a crystal ball. I don't really know what's going to happen, but I do know that if you have a good staff and you're a growing business, your staff retention and acquisition strategies will very much need to take this into account. And then the last really major thing, I think, I mean, I don't know if it's major, but it seems major to me, is that the individual plans are required now to offer pediatric dental coverage as part of the family or individual plan. So if there's a child on the policy, pediatric dental coverage is covered. And that's that's a good thing. Now, but individual plans will not cover adult dental. So that's you'll need to seek out an individual a dental or vision plan, and those plans will not be offered through the marketplace. You'll have to consult with us directly to look at vision or dental plans if you're interested in those. And then the question that did pop up previous, which is funny because now we have a slide on it, is can you come to our dental society or our study group and present these changes direct? And yes, we can. Right now, we're currently scheduling training and speaking engagements now to bring these changes. And I think more than a webinar can provide is the interpersonal interaction with the questions. I think that's an important format. So if you're interested in that, and we'll go and we'll definitely meet with you anywhere in Texas for sure. So just give us a call and we'll schedule that and make that happen. Um, and then just as a side note, as a gimme, anything we do as far as training goes, we're an AGD PACE CE accredited provider, so we can give you CE credits for the presentations that we provide. So that's a bonus there. And then here's some resources. I'm just going to flip through that so you can pause the video if you're watching a video. I would say the main one here, just to flip back, is healthcare.gov is going to be provide you with some information, and then any insurance company that you're familiar with, they will have resources available on their websites as well. Okay, they want to continue to work with you through this process, and these companies will still be there. There are no, they're going to continue to underwrite these policies. So Humana and Aetna and Blue Cross Blue Shield and all these guys, they're still wanting to support you. So um, and so that's it. So what I'm going to do now, we're going to discontinue the recording, but if we're going to post this out on the internet. So as a watcher of the video, if you're interested in talking to us, there's our contact information. If you found that this was informative and helpful, please rate us, subscribe, and we've got a lot more videos coming up about this and other things. And I certainly appreciate everyone's patience in getting through the process as far as the registration for the class. Like I said, it looks like we ended up with 84 people participate. So hats off to you guys for taking the time, and thank you for listening to me. I very much appreciate it. Y'all have a good day, and we'll talk to you soon. Thank you.